mobilization challenges, and bedside scorecard refresher. Prior to performing a patient mobilization task, every care provider will instruct the patient to complete a series of mobilization challenges to determine the safest level of transfer for the patient. The first mobilization challenge is to test the patient on the bed. Is the patient able to comprehend and cooperate? Is the patient able to assist with weight shifting on the bed? If the patient is able to pass these mobilization challenges, the patient is scored a 1 on the bedside communication tool. Next, the patient is challenged to sit on the side of the bed, unsupported, for approximately 5 seconds. If the patient is not able to sit unsupported for 5 seconds, the patient will remain a 1. If the patient passes the sitting challenge, she will be scored a 2. Next, the patient is challenged to stand unsupported for approximately 5 seconds. Again, if the patient fails the challenge, she will be scored a 2. If she passes the challenge, she will be scored a 3. Finally, the patient is instructed to march 5 to 10 steps in place or weight shift in place for 5 to 10 seconds. If the patient requires a walker or cane for normal activities of daily living, the same tool should be utilized while conducting the mobilization challenges. A patient may not be scored 5 or independent if the patient is a fall risk. All fall risk patients require a caregiver to be present during mobilization tasks. Mobilization challenges will need to be completed again prior to assisting the patient back to bed. Once the patient level is identified by the care provider, the bedside mobilization scorecard will need to be updated. The bedside mobilization scorecard may be updated by any caregiver assisting with patient mobilization tasks. First, the caregiver will update the date and time. Next, the caregiver will circle the patient's score on the bed and off the bed. Remember, occasionally the patient may not be scored at the same level for both on-bed and off-bed transfers. Once scored, the caregiver will communicate the patient's mobilization needs, procedures, and any assistive devices or tools that might be required to aid in safe mobilization.